Good day to the viewing and the listening public. This is the COVID-19 update for Monday, May 3, 2021. I am Godfrey Brooms, and with me is the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, thank you for being here. Starting today's program, Minister, yesterday you visited several COVID-19 vaccination sites in Linden, Region 10, yes. Can you walk us through the nature of your visit and also share some of the public's concerns regarding the current vaccination program in that area?
Well, thank you very much for that question. Indeed, the Cabinet had outreach in Linden because we recognize that we haven't been seeing many persons coming forward for their vaccination. We had spoken about this before. And while most regions now would have accounted for maybe 30% or so of their adult population um, getting the first dose of the vaccine, what we have noticed in Linden is that there are about 8.6% of the adult population who have received their first dose. So we wanted to go up there and to encourage people to get their vaccines. Yesterday, I was joined by a number of cabinet colleagues, including Minister Ashni Singh, Anand Prasad, Minister Pauline Sukai, and Minister Yu Todd. And we were able to visit a number of the vaccination sites that we had, um, you know, getting, trying to encourage people to get their vaccines. Yesterday, we had 11 sites that were up and running. And, um, and we did a lot of work talking to people. So we ended up at the end of yesterday with 119 persons taking their first dose, and I think that's a positive step. This has been the highest so far in the region where people came out and take their vaccines, and we'll continue to encourage persons to come out and get their vaccines. Of course, we had several engagements and programs on the radio and TV and so forth. And in some of the call in programs, people call in to ask questions because they were getting conflicting and confusing um, information. So we were able to talk to some of the folks who call in and to dispel some of the myths that people might harbor. This would be an ongoing effort to see how we can encourage more people to come forward and get their vaccine. So I think yesterday we were off on an encouraging start. I was very pleased that on one of the radio programs that the regional chairman of Region 10 came forward and also spoke to the citizens of Region 10 and encouraged them to come out and get their vaccines.
Thank you, Minister. Following yesterday's visit, are you confident that the Ministry of Health will see a higher uptake in the COVID-19 vaccines in Region 10?
Well, we are hopeful, and I think we've had an encouraging start. Yesterday, with 119 first dose persons receiving their first dose, that was the highest that we have had in a day. So it's encouraging. And I think with more people understanding the importance of getting their vaccine, we should start seeing more people taking their vaccine.
Minister, you mentioned that 30% of the adult population in the other regions have taken the vaccine, and despite this is relatively high, are you planning to make any such visit in the other regions?
Yes, my plan is to go to all the regions. I have been visiting and talking to people in some of the other regions, but my plan really, and my the colleagues in the cabinet, they have also been going out and talking about vaccination. As a government, we all want to encourage everyone to take their vaccines. And if we are going to get to herd immunity, it would mean that most of the adult population in Guyana would have to take their vaccine. So while it's not mandatory, we are encouraging people to come out and get their vaccines. So it's really important that we explain to people, and I think once people understand the benefits of the vaccine, they would of course would like to take it, and we want to make sure that we have vaccination sites that are quite accessible so that people can easily go to them and get those vaccines.
Thank you, Minister. To date, how many vaccines have been administered, the first and the second doses?
So for the first dose, as of yesterday, we had 142,869 persons receiving their first dose. Um, and for the second dose, we've had so far 5,035 persons. So again, what we notice on the weekends, there usually a drop off in terms of uptake, and during the week, that would tend to increase. So we'll be expecting that there'll be more people coming forward during this week to get their vaccines.
Minister, if a person contracts the disease after taking the first shot of the vaccine, can that individual take the second dose before recovery?
Well, it depends. If, as you know, the interval between first dose and second dose varies. So for the AstraZeneca vaccine, that can be up to 12 weeks. So if you got infected and you got a mild form of the infection after the first dose, then it probably takes about 10 days or so for you to recover. And therefore, you would be able to receive your second dose when that time comes, because by then you would have been fully recovered. In other instances, let's say with the Sinopharm or the Sputnik, um, again, if you got infected after your first dose, depending if it's earlier, um, let's say a few days after you received the vaccine, then more than likely that 10 days would be up before you're ready for your second dose. If it's the later part, let's say after 2 weeks or so, um, you got infected after 2 weeks or so, then we'll have to see. We can delay it a little bit to allow for you to fully recover before you get your second dose.
Thank you, Minister. Is Ghana looking to further reduce the age eligibility for vaccines to 16?
No, and the reason being is that all the vaccines that we are currently using, they have been uh, tested for people 18 years and above. And so that's why we have been using this age limit of 18 years and above. They are clinical trials that they're now doing with lower age groups, but the results of those clinical trials are not currently available because the trials are not completed. So when those trials are made available and when we review the data, then we can make those decisions. But as of now, we are going to stick with 18 years and above.
Minister, are children at lower risk of contracting COVID 19 than adults?
Children react a little bit differently from adults, and there haven't been many cases of severe form of the disease, COVID-19, in children. Nevertheless, children can be carriers of the disease and pass the disease on to adults. So it is important that we also monitor um, what is happening with children, and if they do have symptoms pertaining to COVID, that we test them to understand whether they have or they don't have the disease. And then if they have the disease, to take all the necessary precautions with them. But generally, children would have a more lighter form, if you like, of the disease.
According to an online news agency, 3 students have tested positive for COVID 19 in Linden. Can you confirm whether this report is accurate? And if yes, can you explain to us how the health authorities in Region 10 are managing the situation?
Well, I don't know. This might be an old report because we did have maybe about 2, 3 weeks ago about 3 children in Region 3 that tested positive, and they have already gone through their period of isolation. and have now been discharged. Nevertheless, the persons that the children might have been in contact with have been offered testing to just make sure that they're not positive. And so tests were done for those teachers and other people who would have been in contact with these children last week. And some of this would continue this week as well.
Thanks, Minister. The United Nations General Assembly declared May 3 to be World Press Freedom Day. As the COVID-19 pandemic has spread around the world, journalists have made covering the crisis a priority. To this end, can you say that if you're satisfied with the way journalists have been covering or reporting on COVID-19 in Guyana?
I think the media plays a very important role in disseminating information to people in Guyana and across the world. Uh, in conjunction with the actual disease, one of the challenges that we would have had with COVID 19 is that there's a deluge of information, and one would have to um, sift through that to really make sure that people are getting the important things so that they can make decisions. Journalists, in many instances, have played a very positive role in getting information out to people and helping them to make those decisions. And locally, I think all of our journalists have been quite responsible in the way that they have been reporting the pandemic. And I would want to thank them for all the work that they have done so far, because without getting information out to people and getting the facts out to people, we could have had more of these myths that have been circulating. So I know that lots of journalists here, as soon as they hear about myths and so forth, they try to dispel them. And I really want to commend them because, you know, we don't want people to believe in things that don't exist. We want them to get the facts so that they can make up their mind and to act accordingly. So kudos to all our journalists who have been working, and I would encourage them to also keep abreast with what we are doing in the ministry, in the government, and make sure that if there anything else that we can do to help um, provide information and so forth, that they reach out to us. So I want to thank them. And on this important day of World Press Freedom Day, I think we have to salute the work that journalists do, not just in the pandemic, but in many other spheres of human activity. And it's important that they maintain the integrity and share information with the general public.
Thank you, Minister. On the issue of myths, there is a belief that certain blood types have less severe COVID 19 infections, so getting a vaccine isn't necessary. Can you speak to this?
Well, there are all kinds of things that people would come up with. Um, some of it is basically excuse of trying not to get or trying to prevent people from taking the vaccine. There have been no study that I have seen that talks about blood group and vaccination. And so I would say this is a myth. We know that vaccines work. The basis on which these vaccines work is that they stimulate your immune system to create antibodies so that if you encounter the virus or if you were exposed to the virus, then your immune system would have a head start in reacting and to eliminate the virus from your system. So blood group doesn't play a role here, and I would encourage persons to go out and get the vaccine.
And finally, Minister, there is another belief that the vaccines would make the population IQ decrease.
Again, there's no study that deals with IQ and vaccines. Many of the vaccines that are currently in use have been the technology that have been used, the components of the vaccines that have been used, have been around for more than 50 years, even longer. And so different ways these vaccines have been tested on human population, and none of them have shown that they decrease people's IQ. So again, this is another myth, and these vaccines are protective. The bottom line is it's going to protect you from getting COVID-19. It will reduce your chances of infection, reduce your chances of being hospitalized, and reduce deaths. So the benefits of these vaccines far outweigh whatever risk, and there's no risk that it would lower your IQ. So again, this is one of the myths that have been out there, and we can assure everyone that if you take your vaccine, it's not going to lower your IQ.
Thank you very much, Minister. This has been the COVID-19 update with the Minister of Health, the Honorable Dr. Frank Anthony. For more information, you can visit our website at dpi.gov.gy and our social media platforms. Godfrey Brooms is saying goodbye for now.